In more than a week since the Smitty's plant explosion rained down an oily soot on the Roseland community, officials have not said what chemicals may be in that soot. Dr. Brobson Lutz joins us this morning to tell us what you might need to fear and what you shouldn't worry about. Good morning. How you doing?
Good morning, Rob.
Yeah, all right. So let's talk about this. A lot of folks in the first 24 hours really after this fire and explosion in that area saw this oily soot type residue that was raining down on their cars, their homes, their properties, their livestock. And it's certainly concerning at first. What do you make of that, and what are the potential impacts?
Absolutely, it's concerning, but from a environmental standpoint, it's better to get it out of the air on the ground and let it wash away, even though you do have concerns about water pollution and such. And anytime you've got a chemical fire exposure like this, you've got short-term effects and you've got long-term effects that you worry about. Short-term effects, eye irritation. I worry about people with asthma, precipitating asthma or lung problems, but that's all over now. So as far as long-term, and what we know from other major fires is that long-term effects usually do not follow a single event. Now, firefighters like out in California who are fighting those forest fires and breathing smoke all the time, that's a different, that's major concerns for cardiovascular and cancer potential causing problems. That fire we had out in New Orleans East a couple of years ago, that continued smoke exposure, that would be of much more concern to me than this fire that went for 2 days.
Sure.
And dissipated.
Yeah, and, a lot of folks, though, still were wondering about, hey, this residue. Initially, they were told, hey, let's not clean it off yet. Figure out what's going on with it before you start to clean it up. Now, the parish had been helping get out some cleaning supplies for those folks. You saw some video there where folks were spraying down the eaves of their buildings and whatnot, trying to clean this off. As far as the secondary exposure now to, what people are seeing out here, what is the potential health impacts of that? What are the impacts of that? And what, should people be concerned about going outside and cleaning their property?
Well, no, I don't think so. I think it's safe to go out and clean your property. You worry about the long-term effects of the environment and various creatures that live in our waters and all. You worry about that. But I think the quicker this sort of goes away, the better it will be. Now, the environmental trauma, the psychic trauma, the depression, the worrying about it, those are the true fallouts from this oily substance coming out of the air. And that's been true with chemical fires all over the world. The concerns about, well, what have I been exposed to? And then people always want to know, well, what about a test? Well, there are thousands of tests out there. There's even a battery of tests for so-called permanent chemicals. But if it's elevated, nobody knows what to do with the result anyway. There's no evidence that an elevated level of a forever chemical is associated with anything. So people saw people were being encouraged to contact their physicians. Well, I'm a physician. If somebody called me, I really wouldn't know what to test for. Okay. And I don't think testing for anything makes any difference. So use some common sense on this.
Sure. All right. Well, it sounds good. Some good tips there. Appreciate it as always.
Thank you.